Hi, my name is Gima and I'm a personal trainer, and today we're going to go over a corrective exercise program to help with knee valgus. So that is when you have your knees cave in an exercise like a squat, for example. So for some people it's a big deal and their knees really cave in, and some people it's just slightly. Either way, if you feel like you have this problem or if you notice other people that have that problem, these are some exercises that you can work on that you don't need a lot of equipment for, that are going to help you prevent that problem, that are also going to help you recruit the muscles in the best possible way in exercises like a squat, like lunges, like split squats, and also prevent from getting hurt, right? Because you want to stay away from injury. And if you have a compensation like that and you're doing a ton of squats and lower body exercises and your knees are caving in, potentially at some point you might even get hurt, so you want to stay away from that. So the first thing that you want to do is, if you have a foam roller, I would say that's probably the best myofascial release tool that you can use. There's other things like a rolling pin. You can even use a lacrosse ball or any other type of tool that you can use to massage those muscles, because that's basically what it is just getting into that muscle tissue that is usually tight. That normally is when the problems start, when muscles are tight and or weak, or a combination of both. So what you want to do first is we're going to start with 30 seconds of foam rolling on your calves, so your gastric and soleus muscles. So you can do both at the same time for 30 seconds. So you want to foam roll your whole calves. If you find a spot that's like real tender, you can just sit on there and you don't have to keep moving up and down. You can just stay there. Now, if you feel like you need more pressure because the foam roller maybe is a little soft, you can always cross one leg on top of the other, and that's just gonna apply more pressure on one leg, and just do one leg at a time for 30 seconds and then switch to the other one for 30 seconds. All right? You don't want to be foam rolling for too long, so that's why I think 30 seconds is a good amount of time. Maybe a minute if you need a little bit longer. And then after that, you're going to move to the back of your legs, to your hamstrings. So you're going to do the same thing. Try to keep your legs straight and just roll up and down. And same thing, if you feel like there's a spot on your hamstrings that's kind of tight, you can just sit on there and just basically relax there. Let that foam roller get into that muscle tissue. Just stay there for about 30 seconds to a minute, and then move on to the next one. So for the next one, you're going to place the foam roller like this, and you're going to massage the inner part of your thigh, so your adductor muscles. So what you'll do is, I recommend that you start with your forearms on the ground, and then you start working your way to your inner thigh, from your knee to your inner thigh. You don't want the foam roller right on your knee joint. You want it a little bit higher, so where your knee starts, like just move up a little bit further, and then just get all that area of your inner thigh. And again, if you feel like there's a spot that's like super tight, you can just sit on it for about 30 seconds to a minute, and then obviously do the other side. So once you've done that, you're going to foam roll your TFL and IT band. Now, there are some people that say that foam rolling and stretching the IT band and TFL is not the best. There's some research that shows that it's not bad, and some research shows that it's actually good. So it's really divided. You shouldn't go by what one study says or the other one, because there's no enough evidence to say it's good or it's bad. I would just say, if you feel like you need it and it doesn't hurt, it's not extremely painful, then try it. If you, from the very beginning, feel like, oh, this is not something that feels nice, I cannot tolerate the pain, because sometimes foam rolling is really painful, especially if you've never done it and you have really tight muscles. So if you feel like that's the case for you, don't even go there. You can skip that part, but if it feels all right, you can do it. So it would be the other side of your leg, the outside of your leg. So your TFL and IT band that runs all the way on the outside of your leg, that's what we're gonna try to get. So same thing, you would start with your, I recommend you start with your forearm down, and then you're going to foam roll the outside of your leg. Again, trying to avoid getting on joints, right? So you don't want to foam roll right here at your hip. You don't want to get all the way down to your knee. So just basically from where your knee is all the way on the outside of that thigh, that's where you want to foam roll. Same thing for 30 seconds to a minute, and then do the other side.